So, I mean, obviously, I think that we all see the problems with the healthcare system. It's sort of a weird Frankensteinian monster, this sort of private public monster in which virtually all medical care in the United States is publicly subsidized at some level by Medicare, Medicaid, by hospital reimbursements that are involved with local and state regulation. The levels of regulatory thickets and the amount of administration, the administrative cost for healthcare in the United States is extraordinary.
Yeah.
It's extraordinary. And, you know, I think that the big problem with healthcare is that everyone, it's such a thicket now that no matter which side you come at it from, you are going to get wrecked for even poking a stick into it, right? The minute you poke a stick at it, ooze comes out. Because if you come at it from my side of the aisle, which is it needs more privatization, we should get rid of the connection between your employment. I mean, if I were coming at this tabula rasa, you get rid of the connection between your employment and your healthcare. It's absurd. Why is your employer paying for your healthcare in the first place, right? You should.
Well, how would people? So, look, I agree with you on that. I think a single-payer system would do away with the need for employers to provide coverage for their employees. I actually hate the system where if you're working at a place that you might despise and you want to move on, or maybe you want to start your own business, right? You're less willing to do it if your healthcare is reliant on you staying at the company you hate so much.
Right.
I think it's actually stifled a lot of economic growth. I think there would be a lot more small businesses, successful small businesses, if people had that freedom to just walk away knowing that they wouldn't lose their health coverage as a result. You get what I'm saying?
No, first of all, I totally agree with you. I think that's...
And there's a point of agreement between all three of us. Hey, kumbaya moment. Let's all agree to agree.
That's why I would prefer to go back to individual and community-based insurance, right? This is why the lack of social fabric really is a problem, because in my vision of a perfect healthcare world, essentially because you know your neighbors and you know your community, you don't want your neighbors to die, your community helps subsidize your healthcare. But I have very serious doubts about the national community subsidizing healthcare at a large scale, because I don't know that person in New York. I don't know what their habits are. I don't know what incentives they have to engage in the healthcare structure. And you do see a wide variety of sort of models that have been used, right? Singapore is a much more privatized healthcare system than, for example, Great Britain. So there are a bunch of different ways to sort of slice this particular issue.
Yeah, you know what's interesting, because we hear a lot of, I mean, I feel like the right wing in America puts words in the mouths of Canadians and people living in Great Britain when it comes to their health insurance, policy, and their nationalized health care. But you talk to them and they seem to love it. So I'll give you an example. So when Boris Johnson was running again for prime minister, what was really interesting is how he kept emphasizing the need to bolster.
Oh, it's a third rail there. You can't touch it.
But it's a third rail because of how much the people living there love their healthcare system. And so there's freedom that comes along with that. When you consider the fact that our life expectancy in the United States is comparable to that of Cuba's, there's something broken in our system.
Well, I mean, so first of all, I mean, whenever we get into these sorts of discussions, you have to start looking at apples to apples comparisons in terms of the demographics of the United States, our age, the ethnic composition of the United States, because different ethnicities actually have different health problems disproportionately. You have to look at the poverty rate in different areas. Obviously, the life expectancy in Vermont is significantly higher than the life expectancy in, say, Alabama, and so that is a wide gap that is not really attributable necessarily to healthcare quality, because again, the same national system applies to both Vermont and Alabama. So you have to, the United States is also a country of 340 million people. Cuba is a country of significantly fewer people. So I mean, all of these, this is why I sort of object to any attempt to use Norwegian models and apply them to a significantly more diverse, heterogeneous, and large country.
Well, okay, so let me.
What you already know.
To that, because if you look at what's worked, because Cuba, I mean, obviously incredibly poor country, especially with embargoes and all of that. Donald Trump declared it a state sponsor of terror, which led to other countries feeling very uncomfortable doing any business with Cuba. So its healthcare system is severely under-resourced. But what they've done correctly is they've focused most of their energy on preventative care, because preventative care is less costly than just allowing people to get super sick. At that point, whatever illness they have is a lot more costly to deal with. So they're like, all right, we don't have the resources. We just got to make sure we really hone in on preventative care. That's worked out really well for them. Whereas in the United States, people aren't getting the preventative care they need to prevent severe illnesses because it's so costly, right? So we need.
That has nothing to do with the cost. I mean, the main thing that has to do with the fact is that we are a first world country. We don't eat properly. Our diet sucks. We eat crappy food. We don't care about that. Look, it doesn't matter. In Cuba, you don't supersize in Cuba or triple size in Cuba. All right? You don't have the types of foods that make people sick, that aren't the good kind of foods. We consume way too many carbs in this country, way too much sugar. Childhood obesity, adult obesity is it's epidemic proportions. Diabetes, 1 and 2. I mean, it is unbelievable. But that's because we are a first world country and we eat and gorge ourselves on so much crap we put into our bodies. That nutritionally is where we're deficient in. And I don't mean in terms of we get plenty of nutrition, but what I'm talking about is that in terms of just being completely careless of our bodies and making sure that we eat properly. But you can't regulate that in a free society. You just can't. So what Anna is basically saying is that, it's just a cost factor and, it's preventative diseases and that they just do it. No, there's a lot of things between what you eat, how long you eat it for, what you put into your body, what it's going to do to your body. These are all those significant challenges that do occur.
Need to do something.
Well, I mean, first we should tell people to stop eating so much. I mean, the United States is an extraordinarily fat country. I mean, by the stats, we're a very fat country. I mean, you compare us to Cuba, you compare us to anywhere in Scandinavia. This is a country that has, this is why during COVID, people would say 40% of the population has pre-existing health problems. And meanwhile, Sweden's like, let her rip, man, we're all in great shape. But it's, so again, comparing apples to oranges is a very difficult thing. When it comes to the NHS or Canada, the only pushback that I give there is that you'd be hard-pressed to find a government-provided universal system of any sort that is widely disparaged by the people who benefit from it. Meaning that if you have no available alternative, people who are on food stamps like the food stamp system, people who are on welfare like the welfare system, people who get student loans like the student loan system, people who get government-subsidized mortgages like the government-subsidized mortgage system, once you make people dependent, which is why in the United States, as I say, anytime you poke the status quo from either side, you get penalized, right? People will say, I hate my healthcare, and then the minute somebody tries to screw with their healthcare, they're like, God, we got to go after them.
I mean, I think Medicare is a good example of that. So is Social Security.
It is. They're both going to be insolvent, but that's...
I don't think that's necessarily true.
We'll have to raise taxes pretty dramatically.
Yeah.
Or lower benefits, or lower the retirement age, which is really what we should do,
I think you're going to hate me for saying this, but I think the cap on Social Security taxes should be lifted entirely.
Oh, no, I'm not. By the way, that is at least an ideologically consistent position.
Yeah.
Meaning that if you are going to say that we need to maintain Social Security as it currently stands, as a defined outcome plan as opposed to a defined contributions plan, then of course you're going to have to raise taxes.
Right.
I mean, like I'll say that, I have more, it is a more honest argument to say that we want Scandinavian style welfare systems, so we need Scandinavian style taxes, than the lie that is currently being pursued by both sides, I will say, that we have to spend exorbitant amounts of money and never pay for it under any circumstances, and then just basically bet that the bill will never come due.
Right.
So if you say raise Social Security tax, I'm like, okay, fine, that's an argument we can make, right? Because what I object to is you'll say raise Social Security taxes to pay for Social Security, and I'll say I don't want that to happen. That's a good debate. What I object to is if I'll say, listen, in order for Social Security to maintain, you're going to have to go to austerity measures. You're going to have to cut the age of retirement because people are living longer. You're going to have to you're going to have to raise taxes. And the person on the other side will say, none of that's true. It's like, no, one of those things has to be true.
But yeah,
right?
but see, that's what I'm talking about. Just going back to our conversation earlier, determining the difference between a good faith or bad faith individual and whether or not you debate with that individual. This is exactly a perfect example. You're being honest. And you're at least acknowledging, the flaws from the bad faith people, the inconsistencies from bad faith. Like, why even engage in a debate with someone who's inconsistent, isn't honest about what they really want? So I just wanted to go back to that.
No, well, the fact of the matter is that if you really go ahead and debate that type of person that you're talking about, my answer to that would be is debate that person. You debate with facts. They're going to debate with what you think are lies or misleading statements or mistruths. The people that are listening to those debates, they want information. They're starving for information. They are thirsting for information. They're in a desert and there's no information available and they're searching for it. They will be able to find the mirage. Is the mirage that other person that you're talking about? Or is the mirage actually you yourself? Let the people decide. And if you think you've got the facts, the figures, the statistics on your side, hey, and the truth is on your side, we'll be able to discern that. Don't think that the people that are listening on both sides of the aisle, whether they're Democrats or liberals or conservatives and Republicans or right or left, they're not stupid people. They want to engage. They're thirsting for information. And then they can take the information from both sides, discern it, decipher it, look at it, investigate it, and then let them come up with their own answers, their own decisions, and let the chips fall where they may. Don't be afraid of debating people that you think are, not of good faith or whatever. That's not your decision to make. I mean, it's decisions you're to make if you want to go ahead and debate or not debate them, but don't do it with that type of mindset and that type of thinking. That's just my position.
Yeah.
Conversation, because it's a perfect example of what I mean.
And I think this also ties back into, again, that localism conversation that we were having before.